Hi, Melissa.
Hello, how are you?
Not bad, not bad.
Good.
Hanging in. Hi, Edwina. She didn't hear me. Hello?
Buddy, I make
Morning, everybody.
Morning.
Here we go.
Hi, Steve.
Morning. Well, almost, I guess it's still morning. Yep.
Yeah, we got 5 minutes left.
All right, Tom.
Not bad. How are you? You start coaching?
They've done some things in the morning. Yeah. Yeah. Different.
Yeah, I'm sure it is. I'm sure it is. They'll have to use the weight room.
In small groups.
You know.
Well, hopefully they won't.
Good afternoon, everyone.
Hey, Bill.
Bill.
Hello.
Jenks.
Hello. Am I there?
Yep,
You got me
got you,
there?
Tom.
All right. Even though I'm in the secret mode there, I still can't get that screen straight now. I don't know what the heck that is.
Did you start lunch already?
Yes. Huh? I said you can come in the kitchen. I will listen, buds. It's not started yet. So what's the first thing they do? Come here. You gotta take notes. They're gonna ask you how it goes. What's the first thing they do?
Yeah, this is the pool meeting. Yeah. I think I'm muted. Hopefully I'm muted.
You're not.
I'm not muted?
Nope.
Oh! Yeah. No.
Melissa, will you check and see if we have all the councilmen present, council folks present? Melissa?
Yeah, I'm checking the list here. Or do you want me to roll call? Are you
Well,
ready for roll call or no?
yeah, just roll call, please.
Okay, sure. Councilmember Boucher,
Here.
Councilmember Woodward,
Here.
Councilmember Brunner,
Here.
Councilmember Jenks,
Here.
Councilmember Menon,
Here.
Councilmember Jarrett,
Here.
and Council President Mull.
Okay, thank you. Okay, we'll call the meeting to order and we'll start with the Pledge of Allegiance. If you can say it quietly, I will say it publicly. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Since we just did the roll call, we'll move right into public comments. And the topic of conversation this morning is the Wyomissing pool. I'd be happy to entertain anybody that would like to speak on the issue.
I'd like to speak. My name is Eric Donahue.
All right, Eric. And would you give Melissa your address, please?
It's 1840 Brandywine Road in Wyomissing.
Okay, go ahead, Eric.
So I first want to thank everybody for having this second special council meeting to consider opening the pool. I've reiterated this on many Zoom calls that I do believe that we have the capability and the things in place to be able to have a safe summer at the pool. I know that social distancing will be fine because of the size of the pool, even with the governor's new orders. Most of the time when I'm there, even at the busiest times, large parts of that property aren't even utilized. So I don't think that would be an issue going forward. And I would just say that I would hope you guys would reconsider opening the pool for the kids in the area so they can have some sort of normal life. And I will say this, what's happening too is anybody that walks past the creek every day can see more and more people, kids specifically, swimming in the Wyomissing Creek. especially the deep ends, which I think is obviously going to open up for a lot more of a dangerous thing than having the pool open. But I would like to actually ask. I see Dr. Barbera is on this call, and I would like to see if he can speak. You know, obviously he's more of an expert in this and a frontline person. So I would give it to Dr. Barbera.
All right, thank you, Eric. Dr. Barbera.
Hey, thank you, guys. Thanks, Eric. And hey, it's Chuck Barbera, 1030 Old Mill Road. Hey, I very much appreciate exactly what's going on with COVID. And I think that the council has been very wise to evaluate this issue thoroughly. There is not a rule book that we can play with and say what is the right answer here. But what I will say is right now we have two responsibilities from where I see. One is mitigating the effects of this virus and using common sense. And two is getting back to normal, because this virus is not going to go away. And so I think that our responsibility as community members, I'm a physician by training, we have to help the public do both of these things. And we need to make sure that we create not only the pool, but other environments that are safe. And we know there's a lot of things we can do. We can wash our hands. We can wear face masks. We can set a limit to the number of people that are on the grounds of the pool. We can do things to mitigate the chances of this disease being spread if it were to happen. We can even take the temperature of people that come in, and if their temperature's high, not let them in. I mean, there are a lot of things that other communities have done to mitigate these risks to their community. Some communities have actually, like on the football field, like they do with the lines for the football games, put kind of 6 feet marks in the grass so that people will come and know this is how you have to socially isolate. The public's used to this. This is not a strange thing to the public. I think, you know, one thing we know is that the CDC has found no evidence that the swimming pool properly taken care of carries COVID. So I don't know that anyone's worried there are COVID viruses floating in the pool, right? It clearly is the behavior that accompanies large groups of people, especially kids, that it's difficult to contain, and I get all that. To Mr. Donohue's point, though, the other thing I would say would be that what are the effects of not doing this? And there's a couple, but the risk of swimming in the creek unsupervised, clearly that's a risk. I worry more about the Schuylkill River and other places where kids will go, because once a year we see somebody drowning there. We certainly see infections. We know that we can't supervise that. Now, maybe that is a borough risk or maybe not. My guess is if a kid has a bad event in the creek, the borough is as much on the hook as if they did in the pool, where they can control it. The other thing is really to show the community that we can responsibly handle this. At some point, we are going to have to develop these kind of processes and protocols. I think it's going to be a higher burden on Mrs. Fanning and the rest of the pool staff to make sure that our lifeguards now are going to get a great experience in being really, in addition to being lifeguards, into being, you know, more disciplinarians and learning about the disease. But I think it can be done responsibly, and I think that we can do a bunch of other things. We can have people sign up for times. We can limit the amount of times people are there. But I wouldn't totally say not to open the pool as we're heading into a weekend where we're going to hit the 90s, and we really don't have a lot of options for our children to do much else. And I think with that, I'll stop. But thank you, Mr. Donahue, for allowing me to speak.
Thank you, Doc. I much appreciate that. That was enlightening.
Yes.
Anyone else wish to speak or address council? Okay. I'm sure that I see on my screen that there are some people out there, and if you all have the same thing or same opinion as Mr. Donahue and Dr. Barbera, that'll be fine. I'm going to ask the borough manager, Pat Brandenburg, to give us an update on the pool and his comments, please.
Thank you, sir. I'll start out with just some comments, and then I'll get to the pool status check. Let me start by saying I truly do recognize and understand how important the Wyomissing pool is to our community, and especially to the children in our community who have already been impacted so much by the events of the past several months. I just want everyone to know the impact on pool members, especially the kids, was something that's absolutely considered and something we certainly care about a great deal. You know, I have a 12-year-old home who was planning to be at the pool this summer, so he's disappointed as well. I truly do care, and I truly do understand people being upset about the recommendation to keep the pool closed. I recognize that there are differences of opinion about whether it's feasible or realistic for us to meet all the safety requirements and for the pool patrons to be willing and be able to consistently abide by these guidelines. We cannot lose the sight of fact that we are in the midst of a once-in-a-generation public health crisis. None of us ever dealt with anything like this before. And over the past week, according to all the public health experts and epidemiologists, literally all day around the country. Last week, 13 states were seeing increases. Yesterday, it was 44 states with increases. We've got some increases in Pennsylvania, and Allegheny, Lancaster, and Dauphin counties. And Philadelphia is really even taking a close look at what they're going to do over the next couple of weeks as they get into their situation. Not that that's our situation here in Berks County, yet we cannot ignore the trends and evidence that's happening. We've already seen back in March and April that what can happen and how this virus spreads, and it's spreading faster than ever. We also need to remember that even the foremost experts are still figuring out new things almost every day about the virus and the way it transmits the symptoms and causes the conditions that make a person most at risk of experiencing. So just this week, the CDC added 3 new symptoms to the list of its revised guidance. It's my job as the borough manager to make recommendations and decisions after researching and gathering the relevant information required based upon review, analysis, facts, data, and careful consideration of the big picture in all perspectives, as well as the quality of life impact. I would not be doing my job for the residents of the community if I did not carefully consider all of the other relevant factors, including risk management, liability, health and safety of staff and pool patrons, level of responsibility placed on the shoulders of our young staff, and the potential impact and the risk for the whole community. There can be no doubt that having a venue where up to 250 people can come and go rather than gather for the day, and up to 125 people in the pool creates additional vector for the virus and additional risk above the baseline risk if the pool were closed. Yes, it's harder to transmit the virus outside. Yes, chlorine in proper concentrations left to inactivate the virus, but we need to be realistic about the setting and the responsible to expect. Kids, even the best behaved and careful kids, are kids. They splash, yell, spit water. They forget they can't force play with their friends. They got to maintain that social distancing, and that will be very difficult for them, as I can well expect. Given the date of potential pool opening, any potential outbreak could also be horrible timing for trying to make sure the community is in the best possible position when the kids go back to school in the fall. By providing a venue for a large number of people to gather, we are risking COVID transmission. During the swimming, that could negatively impact the very essential activity of our community being in the best possible position when the kids are returning to school. We have to be proactive, we have to be cautious, and I cannot in good conscience recommend that we take the necessary changes to create increased risk for volunteers for non-essential and through very important activity enjoyed by approximately 10% of the resident households when we look at pool memberships over the past several years. I firmly believe it's not in the best public health interest for our pool to open this summer, especially not with the situation changing day by day. It is absolutely disappointing, and I'm truly sorry to have to make this recommendation, but it's just not something we can afford to get wrong. The risk involved with getting this decision wrong are too great, and the consequences are way too high. That said, please know that if the council should decide to revote and open this pool as of this meeting, my staff and I are committed to do everything we possibly can do in putting all necessary measures in place to ensure the pool is operated safely and possible this summer. And I appreciate you listening to me. The pool work continues with operations at the pool with our public works crews. The tile work will be beginning next week. Tile contractor will be there, and they hope to have all the tile work done. They then will move into start to filling the pool, and we hope to basically have the pool in a filled chlorine-rich environment, which has been tested by July 17th, according to staff. And Rob, who's also on the call, can further give a status update on that. We also have to get our staff on board, which we still are working on. We have not concretely done that yet. We have approximately, we have a lot of staff that we're working on. Currently, 16 of the 36 staff members that we currently will need to operate the pool have gotten all their paperwork and documentation in. So we're continuing to work on that. So that's kind of where the status is. So Mr. Mull, where the pool is. But July 17th would be when the pool itself, from a mechanical standpoint, would be ready. We still need to get the supplies, which are pretty extensive, and get the rest of the policies made, and then get all that in operation, as well as establishing the fee schedule, establishing MyRec software, and basically some other social distancing markings and so forth like that at the pool.
Okay.
I'm sorry to interject here. Am I able to ask, my name is Jody Bukowski. Can I ask a question to the borough manager?
It's a little out of line, Jody, but go ahead.
Oh, well, I'm just curious because there are a couple of other townships who have opened their pool. I think Adamstown and Byrne Township. And I was just curious if he has reached out, or anybody from the boroughs reached out to them to see how that's going. Is the social distancing being followed, and is it going well?
It's my understanding that the Adamstown pool was closed. So I haven't reached out to them. Byrne Township, we've got indicated as temporarily closed. So not sure. Most of the pools that are open in the area are community pools. They're not municipal pools. So as far as reaching out to those pools, no. I know that we've had some interaction, and the pool manager has had some interaction with the Lincoln Park and Wyomissing Hills pool. And there are some concerns at one of the pools, which I'm not really going to lay out there because I don't want to, slander any of our pools.
Okay, thank you.
You're welcome. All right, well, thank you, Pat. Rob, do you have anything to add you'd like to add to this? Rob Lewis?
You're muted.
I had to unmute myself. I apologize. As everybody knows, my job, my profession is all about recreation, community, putting on great programs, events, and facilities. 2 weeks ago, I was very confident moving forward. And let me start again. I do want to compliment the outstanding staff, the public workers who have been down at the pool, working hard to make repairs, get things up and running in case things change. But as of the last week and a half, listening to news stories and seeing cases skyrocket in various areas where there's lots of kids gathering, particularly at beaches and things like that, I've become less confident, not confident in my staff at the pool, just less confident in the ability to keep everybody socially distant. It's a lot of pressure on the pool staff to keep kids away from each other. I've seen it at Happy Hollow Playground, at the basketball courts, at the tennis courts, even in the creek. Kids are kids, they're doing their thing. Can we prevent it? We can try. My biggest concern, my kids are out of college. I don't have to worry about kids going back to school. I feel for the parents who've had to have their kids home all spring and want them to be out this summer. And I'm sure they're looking forward to the kids going back this fall. And I really hope they do. I would hate to see anything happen that we cause some kids to catch it and the schools have to be adjusted. That's not up to me. I know we have a great plan in place. Kate and I have been working along with our assistant manager and our front desk manager. The pool will not look the same to a lot of families. We know that. Everybody's going to have to accept that. It's it's going to be what it is. And I don't see it as a great fun place like it used to be with lots of smiling faces running around, but it'll be something different that they'll be able to enjoy versus creek water. So that's where I'm at. My job is to want to give the best thing to the community. I just am not as confident as I was a couple weeks ago.
Thank you, Rob.
Is Kate on the call?
Yes.
Can we hear from her?
She's muted right now.
Yeah, absolutely.
There she is.
I just think we should maybe hear from her as well.
Okay.
Are we allowed to ask questions, Tom?
Of course you can.
Okay. I would just like to know from Kate, having heard what Pat just said and what Rob just said, and considering the latest guidelines and knowing that there's a strong sentiment about not opening the pool, so that everything that we're going to do, you're going to do at the pool, Kate, is going to be under a microscope. And I'm sure you're going to have some people that are adamantly against this, that are going to be down there with a 6-foot tape measure every time somebody gets within 6 feet of you, of each other. So how are you going to make this look?
Well, hi, it's nice to see you all. In the last 48 to 72 hours, I have been watching pools closing, across our country. And that's concerned me for sure. Rob and I met yesterday. We talked about this in good detail about how we could feel safe in doing that. We talked about a lot of things. So my latest idea to make this a little more feasible and not as nutty was to utilize our website, or what's it called, Rob? Our what's that called, Rob? Our website?
It's called the MyRec system.
MyRec system, and to have people sign up for different time slots. We talked earlier, it was the rec board and maybe even here, how would we do that? Would we reimburse people if the weather is bad? But I've been doing some research, and other pools, they charge a fee, and then you still need to go online and sign up for a time slot. And we can limit the amount of people that are entering the pool based on sign-ups. And then we also talked yesterday about, well, what if you want to sign up for 2 time slots? Well, we say open time slots up at 10 a.m. or 9:30 a.m. and after 2 o'clock, because most people come to the pool between 1 and 1:30. The majority of the pools gets crowded about that time. Maybe 2 o'clock, you can sign up for another time slot if it's open. That system, having that in place, really brought down my stress level about reading these articles and wondering how we could control better what was going on. And then the other idea I had was to have a task force, myself and Rob and Mr. Beck and any other person in charge of the pool, along with maybe Mr. Bruner, who's our liaison, and we meet weekly. And for a half an hour, we go over what's been happening, what the news is saying, what's going on in Berks County, what's going on in Wyomissing, and we evaluate and we touch base every week, once a week, to just to keep the conversation going. But I still believe that it can be done. The whole 6-foot rule is about the size of a swimming noodle. I don't know if you're familiar with those. We talked about having those out with our social distance monitors and saying you're not 6 feet apart. We will have buffer zones between the zones. We'll make announcements every hour or whenever we need to. Hey, zone number 1 has 20 people in it, so we're looking for volunteers to move out of zone 1. It can be done. It really can be done. I do believe that. But I have been watching the news, and I'm aware of it, and I'm also aware that I have 2 teenagers, and I want them to go back into that building. But I do believe that the guards will have to step up, and they will be learning a lot, and they'll learn a lot from me about how they're going to behave outside of that pool and how the responsibility that they have. I'm not afraid to lead them in that way. I believe I can do that successfully. We've developed a very good rapport with them. I believe there's a large amount of respect between myself and the staff. So I do think it still can be done very successfully. Just wanted to maybe change the way we let people in the pool, and also have a way for me to meet with people weekly to talk about what's happening and have some support, for me to have some support.
Can I say something? I'm sorry, my internet went down as Dr. Barbera was speaking, and I had a hard time. Both my computers were off, and I'm tethering through my phone now. And I had a speech prepared. Melissa has the stuff here. I think there are some more things to consider. Mr. Moll, is that okay with you?
I'll entertain. I'll let you go ahead. Go ahead.
Thank you. So yeah, I do oppose the opening of the pool, and I ask everyone, including the council members, to consider the following. And I've heard your arguments most of the time when I was not off. This virus first exploded in the wet market in Wuhan. It is well known that it thrives in wet areas. Recent studies show that it survives for 34 days outdoors, contrary to what was thought before. Although it appears that the treated pool water itself is safe, the wet areas around the pool and adjacent facilities present a great risk. People, and mostly children, spit water, use their hands to blow the nose and wipe their faces, and then touch handrails and other surfaces. Social distancing is not going to help with this. There's no way to control this. Our country is going through a renewed spike of the infection, and here is the latest graph that Melissa has on screen. The numbers grow exponentially again. Just yesterday, there were 51,000 new cases per day, which is an all-time high. At the peak of the first wave, we had 39,000 per day. Now we're peaking again, higher than that. Pennsylvania is also seeing a growth in daily cases since the reopening. It will be foolish to open the pool in these conditions. Third point. At the last infrastructure meeting, I heard a parent asking for pool opening based on the psychological effect on lockdown on their children. One wonders how come people lived for centuries and millennia without pools and did not go crazy. Both her daughters are studying in Europe, where the lockdown was extremely drastic. People faced fines if found on streets. Parks were closed. Alex lived in her studio alone with nobody in the entire apartment building because her student neighbors went home. Literally 4 months of jail. This has been a trying time for her, but she focused on her exam and she's just fine. Our children will come out stronger from this experience unless their parents insist to make softies out of them. If anything, this needs to be a teaching moment for the children of the need to sacrifice for your fellow citizen and the greater good. And speaking of the greater good, our seniors are from the great generation that made so many sacrifices for our freedoms. Some of them are children who saw their dads die in some muddy battlefields fighting the Nazis. These people are most vulnerable from the virus. Is this how we want to repay them for their sacrifice? My wife is medical director at the Highlands. I learned firsthand what this virus does to seniors. They don't even have an infection, fever, or cough. The virus makes clots. Many seniors just feel bad one day and then die of stroke overnight. There is not even enough time to do a test and prescribe blood thinners. Much too often positive test results come after the patient has passed. No chance of survival or treatment. Measuring temperature means nothing. Sadly, I have heard so many times that these people are half dead anyway, so what's the purpose? Finally, I find this drive to open the pool exceptionally selfish. This is a time to stick together and do absolutely everything in our power to protect each other. Opening the pool risks having a snowball effect that, once started, will be impossible to stop with another lockdown. So we looking with a magnifying glass of what the pool staff is doing, it's gonna be gone, because kids, once positive, they carry it for weeks, and that's it. And it's in the community again. So I do ask you to consider, I think I speak for those seniors who probably don't even know what Zoom is. So please consider that. Thank you.
Thank you, Mr. Jadik. Do we have any comments from council?
I would like to make a comment.
Go ahead, Jody.
I've spent a lot of time researching this, reviewing the 17-page draft of the pool policies and safety plan that we have put in place. And I'm not sure if it's people in the community are aware, but there are very, very stringent requirements going beyond, well beyond even what the CDC is recommending, that is part of our plan to open. And I think there are some things that we need to also keep in mind. I mean, everyone understands that the virus poses a risk. It's the world we live in today. And things are starting to reopen, okay? And given what I've seen in this document, I have to believe that this is going to be safer than other things people are doing. They're going out shopping, they're going to restaurants. And I think as we reopen, people just really need to take some responsibility for themselves and the people around them and make smart choices about what is acceptable risk. Okay, there is risk, but we can minimize it. And I think the document and all the effort that Kate and Rob and Pat have put into this
I waited for an hour.
is exceptional, and I commend them for that. They really are trying to do whatever they can to keep this community safe. I just think we really need to keep a close eye too on what things are happening in our particular community. I think that obviously we're seeing what's going on around the country, and that's very worrying. And we know that at some point it's likely to come back to our area. But we have ways that we can monitor this. The vast majority of pool patrons are going to live in the 19610 zip code. We can monitor that every day, and like Kate says, maybe have weekly meetings to assess that. Is if we see that things are getting more dangerous in our community, we can shut it down, and the policies and the safety plan allow for that flexibility if we need to make changes to the procedures or even close. So I think that it's something that we really need to consider from that perspective too. It's a very difficult decision. It's a difficult decision for all of us. And it's going to be hard to know what's right and what's wrong, but we have to make the best decision we can with the information we have available to us at the time.
So Tom Mold, do you want to entertain a motion one way or the other so we can discuss it after there's a motion in a second?
Yes.
Well, I have a couple comments I'd like to make first.
All right. Go ahead.
We can make it when we have a motion on the table.
Yeah.
All right. That was my next order of business, John. Would somebody like to put a motion on the table to open the Wyomissing Municipal Pool?
Melissa, can you reread what the motion was a couple weeks ago?
Are we closing all comments, Mr. Chairman?
We're trying to get a motion on the table. Well, after the motion's over and we have comments from council, I'll open it for general discussion again.
Thank you, Mr. Chairman.
You're welcome. Go ahead, Steve.
Well, I'll make the motion that the we open the pool under the guidelines that we voted on. I forget what the date was, back in June, which include waivers, the fact that we'd still be in green. If we go to yellow, I would assume that the pool would close. We can obviously safeguard, keep the pool safe, require face guards. My bottom line is I want to make the same exact motion I made before. I just don't want to overstep my boundary.
Okay.
Steve,
You're not.
Steve, from the council meeting from June,
Yep.
the motion is as follows. To open the Wyomissing swimming pool for the 2020 season once Berks County reaches the green phase, as indicated by Governor Wolf's reopening plan, operate under state and CDC guidelines. Pool patrons would be required to sign a solicitor-approved waiver unless one is on file already, and that there would be sufficient staffing availabilities and the pool would be in good working order.
That is the motion I'd like to make.
Okay. We have a motion on the table. Do we have a second on that?
Second.
We have a second. Thank you, Jody. Okay. Now,
Other comments?
yes, now we're ready for comments. Go ahead, Tom.
Well, I hear a lot of the medical things, and I certainly, I know it's a very, tangled web with information. I know that. I don't, every day, everybody turns on the news and we get all sorts of information. Some changes, some stays the same, some's good, some's bad, or if you want to call it bad, concerning. I think beside those things, we also have to consider our economic situation for the borough here, and the number of people that we're serving as opposed to the entire population of the town. I think it's a very small number compared to that. I know that the most vocal will be those with kids. I would certainly understand that, and I get it. That is a small number. I think the preparation work, because I know most of us have been down there to take a look at what they've been doing, is it's progressing. There are some repairs that need to be made, and they haven't even gotten to some of the major factors yet, I think, that need to be checked out, including the running of the circulation of the pumps for the filter pits and things. So I think that needs to be considered. Administrating the membership with how much it would cost this year, the fees. And I think administrating this whole thing with, I heard a number, I think it was Rob, I forget who it was now, said we have 16 out of 36 that we need. Is that gap going to be closed to like 34, we get 34 out of 36 and we can do it? Those kinds of things. And I really, because we've all been there and done that as parents, I'm going to tell you, it's easier to say no now than it is to change it once you start getting out the ice cream and the cookies and everything. It's a lot harder to say, okay, let's put her all away. Or let's say now we close the pool because either something happened or we went from green back to yellow and we're already up to July 2nd. I just think there's lots of things to consider here, and we can't close our eyes to the whole picture as opposed to just how the virus is spread. So I'll just throw that in for whatever it's worth. And I'm just as not happy with saying no to opening the pool as anybody is. I can tell you that. It's not a nice thing. That's it.
Thank you, Tom.
Well, I think the concern I have are twofold. First of all, we got a bunch of teenagers trying to enforce social distancing on little kids that don't even know what social distancing is. That's one concern. And the second concern is we're trying to get a square peg into a round hole, and it's just not worth it. That's all I have.
Thank you, John. Anyone else from council?
Yes, Tom.
Go ahead, Bill.
Yeah, phew, boy. Just a couple, since we last discussed this issue, well, we've learned a lot, both, positive aspects and now a lot of negative aspects. My mind keeps flipping constantly, and it did again when we learned of the new policies that were put in place by the state yesterday. Council individually has dwelled on this subject for months, and decisions and votes were made not haphazardly, but with regard, number one, to public safety of our residents and their families. And I hope that everyone would understand that. I think Kate Fanny has done a tremendous job in visiting the other area private membership pools and has adjusted her policies based on her observations and along with state and CDC guidelines. Dr. Barbera brought up a lot of great points. The main one being disciplinarians. It can't be the good old boy down there. Everybody is going to have to not be afraid to discipline others or ask them to leave. And if they don't, then stricter actions need to be taken against that person. These have to be done if this is going to work. My personal observation from people I've spoken with, and Kate brought it up as far as reserving pool times. That's what the Berkshire Country Club did with their pool. And it's worked out very nicely and effectively. Everybody's adhered to it. And I just wanted to say that for what that's worth. The CDC director, along with others, have now said, the beaches and public swimming pools, are safe, provided social distancing is observed and masks are worn when not in the pool and away from their families. The problems there, as everyone knows, has been that a lot of people have left the beach without a mask. They've gone to a crowded bar, had a few drinks, and returned to the beach, again, without wearing a mask. Fortunately, we don't have that concern with our municipal pool. The untimely, safe practices and adherence, to the CDC and state and pool and our own pool guidelines must be strictly enforced. I can't stress that, excuse me, can't stress that enough. So we must adhere to it. And that's all I have to say at this time.
Thank you, Bill. Anyone else from council? One comment.
Chris, are you comfortable with some sort of waiver for everybody entering the pool?
I think the waiver is helpful. I don't think the waiver is a solution to all of the legal risks for the borough, but I think it is helpful. The liability of this is not something which I think should control the actions. I don't have a concern that the borough is going to be exposing itself to some tremendous legal liability. I think it is more of a, it's a matter of managing the public health risk as best you can. And if you make a bona fide effort to do that through appropriate regulations and enforcement of those regulations, then I think you are managing the legal liability exposure for the borough. But I would want to have those waivers in place. And part of the reason that I would like to see the waivers is because I think it reinforces the seriousness of the situation for the users of the pool, so that, you know, there is an express understanding made through the signing of those waivers that that we're undertaking a serious business by entering the public pool.
I agree with you, Chris, and that's the reason I asked the question. It wasn't necessarily about the long-term liability, but more expresses how serious the issue is and making everyone understand that if they're going there, they're doing it somewhat at their own risk and are aware of the potential hazards that are involved with it.
Right.
I'm not sure who to ask this question to, but if, regardless, the pool still needs to be fixed and it still needs to be filled regardless of the decision. Is that correct?
Yes, it
From
does.
an ongoing maintenance program, it still has to be made ready.
Yes, sir. Yes, sir.
Yeah.
The only thing, Keith, is we would need to purchase other supplies that we have not purchased yet, as far as the PPE and COVID-19 supplies and so forth for readiness.
Right. But in the big scheme of things, if something were to change, you're saying that the pool can't open before the 17th of July.
I'm saying from an operational pool actually operating and the systems running, chlorinated, filled, and so forth, that can't happen at least until the 17th. I'll let Rob, give his thoughts on whether he thinks he can have staff on board. Staff has to be trained. We still need 4 additional appendixes to the safety plan that have to be written. So we've got a lot of work to do.
So are we saying that it can or can't open by the 17th of July?
The 17th would be the earliest we could open. They're going to do the repairs next week. Then we'll start filling the pool at the end of the week. It takes a while to fill that up. Then we have to get the filter room and the motors up and running, chlorinated. That part of the functionality of the pool would be ready by the 17th. The other things are getting all our staff paperwork in, getting our signage, getting our trainings up and running. Lifeguards have to go through additional training on rescue and resuscitation. That gives us 2 weeks from now to get all that done by the 17th. And it'll be a rush. It'll be a rush job.
I mean, personally, hindsight is obviously 2020, but I think when the motion was made in June and seconded, I think the intent was to get it. I think if we would have started earlier, we'd maybe having a different conversation than we are now.
Correct.
I think we were remiss in not moving forward in getting it ready earlier. Because I think now, unfortunately, although it's not an economic decision, but there is a certain point where it's becoming so late in the season that it is an economic decision to some degree. And I think we were in error not getting it ready.
We weren't even in green though, Keith.
Yeah.
Well, I know, but the motion, if we have to fill it anyway, the motion that was put on the table was when we go green, if it's possible to do, just like the motion that's there now.
So if I can speak, Keith, you made the motion on a Monday. That Wednesday morning, we pulled the top off and started doing all the work, draining it down and beginning the process then.
Also, there was another motion that came out of infrastructure after the negative motion from council meeting on the 9th. And the infrastructure motion was basically to begin repairs on the pool and then, provide council a status, and then that further discussion would be held. But Keith, you're right. A decision on the pool situation needed to be happening earlier.
I think too that we've got to remember this is a situation that we've never dealt with before. We didn't. Normally in April is when we pull the covers off and start the pool process to have the pool ready for Memorial Day. I don't think anybody in April knew we were just in the throes of this thing, and nobody really knew what they were doing. And unfortunately, it's a learning experience for everybody concerned. And unfortunately, it's not an easy one to learn. And you're right, it is an economic decision, and maybe we were a little slow, but this is what we have to deal with.
Tom?
Yes?
It's Fred Levering. I just want to remind everybody that I understand, yeah, we could have started earlier, but there was a vote of council to not open it. So therefore, things didn't progress as quickly, immediately, as might have been ideal, but it was for a good reason. We voted no. Now that's been reconsidered, and one of the ramifications is the time frame.
The time frame is if July 17th is the number, we will have been closed for 57 days and only 53 days remaining. So, I don't know.
Okay. I'm going to go out of order a little bit before we vote. Is there anybody online from resident that has anything they'd like to say?
Yes, can you hear me?
Yes.
Linda Naylor.
Go ahead.
I'd like to just take a moment to echo the thoughts of your borough manager. I thought that his presentation was very well delivered, very well researched, very well thought out. The one thing that really hit me the hardest was one sentence he said, which is, "This is a decision we cannot afford to get wrong." We're talking about people's lives. On one hand, one pan of the scale, and a pool experience on the other pan of the scale. I appreciate how important this is to kids, but I would urge you not to open the pool. I also want to say that we have the experience of seeing what's happened in communities that have lost their resolve and have opened a little bit early. And what that has resulted in are what we call spikes. Spikes is a euphemism for infection and more deaths. So I really would like you to take this very seriously, as I see you are, and to err on the side of caution. Dr. Barbera made some very good points, and I think in a ideal world, not the real world, we would have all of our kids staying 6 feet apart. But I ask you to look out your window and tell me, are the kids staying 6 feet apart? No, they are not. Are they wearing masks? No, they are not. So I think it's unrealistic to expect lifeguards to be able to change that mindset when they walk through the gates of the pool. That's my thoughts, and I hope you will not open the pool this season. It also seems like it's economically becoming a loss. You've got more days closed than open. Doesn't make sense to me. Thank you for the time.
Thank you, Mrs. Naylor.
Mr. Moll, can I just say 2 words to what Mr. Hartman said? It's Adrian Jadik again, and about the waivers. It's not about the waivers to the people who come at the pool. Yeah, they will write waivers. They're generally kids and they will probably survive an infection. It's who they infect going home. And they don't write waivers to you, the other people that got infected. So you might be fine from the people who attended the pool, but the grandparents and mothers and the nurses who are going to take this to the hospital or nursing home, they don't. So I think it's a very narrow point of view to just get that. We're not talking about breaking his head at the pool. We're talking about spreading an infection in the community. That's all I had. Thank you so much.
Thank you. I'll call for a vote.
Rob Lewis?
Yes, sir.
One question, Rob. I believe it was you that said that so far you have paperwork in for 16 out of 36 staff members. When do you expect to have the others?
We have complete paperwork on the staff. Some staff are missing one document. Kate can also speak to, a lot of the kids have to get working papers from the high school. That's a different kind of challenge. I'm sure we could get that. If we really push the kids to get all their paperwork in, we can do that. You know, we have lost some staff to other jobs. Some staff have a second job, so they can only give us part-time hours. But I'd be confident that we'd have enough staff.
Thank you.
All right.
When do most of them go back to school, Rob?
August 24th. So the pool would be open for 5 weeks.
Max.
Max, yes. Plus Labor Day weekend.
Okay.
Okay.
So Rob,
yes, sir.
One more question, Rob. So you're saying that if it opens the 17th, it would only be open for 5 weeks?
5 full weeks, correct. Because the kids go back to high school on August 24th.
Well, that
And
leaves
and some of
38 days.
some staff will
open
go
and,
back to college too. You know.
Most of them.
So that's it, 5 weeks?
Correct. Unless we try to stay open while the kids are back at school, but you know, we lose a lot of our lifeguards go back to school. Some go back to college.
That's what I was going to suggest is if we don't know what school's going to look like this fall, if it's, you know, half days or something, there may be an opportunity to leave the pool open through September if kids aren't back in college. Just a thought.
Sure.
Melissa Miller. Well, let's get this thing to a vote. If you would.
Can I say one thing? It's Steve Brenner.
Go ahead.
Sorry. Sorry, I don't mean to hold this up. Listen, I understand that the decision that we're making is a no-win situation. I understand that. I understand the issues that have in front of us, but I do look outside my window. I do see kids doing things that I think if they had a place to help safeguard them would actually be better off than what they're doing today. That being said, I don't know if there's any right or wrong. It's just my personal opinion that these kids, quite frankly, need a place to go. I think they need some psychological help in that. We're going to try to make this thing work. Listen, if the cases spike and we go yellow, the pool's closed. But at the end of the day, I am looking out there today and saying that they're not social spacing. And I agree. The only time I see any kids social spacing is in the time when they are actually being observed by adults.
To add on to Mr. Brunner, from a kid's perspective, I'm a 14-year-old girl. My name's Abby Zeckman, and kids are congregating no matter what. And like Mr. Donahue said in the beginning of this, so many kids are at the creek every day on these hot days. And when like adults or older like people are observing them, then that is when we stay separated. But when people aren't, so like for instance at the creek, that's when we're together. So at the pool, it would almost be safer to have adults there watching us, and it would be a safer environment for the children.
Thank you. Melissa, will you please call the roll?
Sure. Councilmember Boucher?
No.
Councilmember Woodward?
No.
Councilmember Brunner?
Yes.
Councilmember Jenks?
Well, I'm the one that requested another meeting on this. Boy. Yes.
Councilmember Menon?
Yes.
Councilmember Durr?
Yes.
Council President Moll?
No. 4 ties. And that means we proceed with the plan of operating the municipal pool when it is ready.
You know what hand sanitizer is?
In my purse. It's gonna open.
Guys, you got to mute your phones. Mute your phones.
Okay. 4-3. So we proceed. I know that there's a rec board meeting coming up very shortly, I think on the 8th, is that correct?
Yes.
And I guess we will, and then it's imperative that we have some financial data for how we're gonna set up for the cost factors, and also get some approval for ordering the safety supplies that the pool's going to need for the season, for the 5-week season. Does anybody else have anything else to be brought before council today? Okay, I want to thank everybody for all their input. It was all very well done and enlightening from all perspectives. And we hope we have a safe rest of the summer. And have a good 4th of July weekend. This is going to be a little different with no parade, but one of those things we're going to have to deal with. Have a good day, folks.
Thank you.
Thank you.